Hey guys, it's the Doc, and here's our next installment of the hashtag Ask Dr. Mudgil series of posts. So this question comes in from Reddit, and the question is, how concerning is it if the dermatologist took biopsies of, in quotes, concerning moles? This is from a 32-year-old female. Went to the derm for a full scan, and they chose to biopsy 4 moles. Is this common practice? Should I be concerned? Well, that's a very, very good question. First, I like that you went to your dermatologist to get a full skin check, which is an important thing to do for all folks who, especially all folks who are fair-skinned, who've had a history of a sunburn, especially a blistering sunburn before they were 18 years old. If you're fair-skinned, have a family history of skin cancer, you should most certainly be getting your skin checked every year by a board-certified dermatologist. So I do like that you did that. The question you ask is a tough one. Not seeing your skin or not seeing you as a patient, it's very tough for me to see what's on your skin. I don't know what the dermatologist saw when he or she was examining you. But I imagine the cause for those biopsies was because there were some atypical features clinically of the moles. Things we're looking out for are asymmetry, border irregularity, color variability, large diameter. Those are generally red flags when we're examining somebody. Now, some folks just make moles that look like that. So a big part of a skin exam, especially when I do it, is I'm really kind of looking for the ugly duckling. You know, sometimes it's very easy to lose the forest in the trees, right? So it's very important for all dermatologists to kind of look at their patients globally and then kind of seek out any outliers that they may see. Now, it's quite possible that these were 4 outliers that your dermatologist saw. So should you be concerned? The results generally come back in a couple of days, a week, maybe 2 weeks at the most. So your dermatologist should definitely circle back with you. You can give them a call just to see what the pathology findings were. I will tell you that as a pathologist and a dermatologist, I'm the guy who looks at these biopsies under the microscope. The bulk of what I see, particularly with pigmented lesions, are that they're completely benign. I'd say 90% plus come back absolutely normal. So again, you had the biopsies done, now you're kind of in that gray zone where your anxiety is probably building as you're waiting for the results to come back. But I wouldn't be overly concerned. Just make sure you circle back with your dermatologist to find out what those results were. And then based on those findings, there may be sort of next steps. If some of the moles were atypical, you may need to have those treated, and you may be seen more frequently for skin checks. If they're completely benign, then your dermatologist will probably recommend that you just keep getting checked once a year. Now that they're sort of, it's been established that your moles, although they may look clinically atypical, if they're histologically, which means under the microscope, if they look normal, then the threshold for biopsying other moles may be reduced a bit. Anyway, so moral of this story is, don't be overly concerned. Just make sure you check in with your dermatologist to find out what the results were, and then your future care will be dictated or predicated upon that. So I hope that answers your question. Let's get it.